welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Hello, friends. Happy Monday and welcome to Brain Chat. It's Dr. Mitzi, your board certified neurologist and MS specialist, and I am so excited to talk with you guys tonight about a topic that's extremely important to everyone, whether you have MS or not. We all need sleep. We need to know how to get more of it. We need to know how to get good sleep, and I have got an amazing expert on tap for you guys tonight. As you know, when you join Brain Chat, let us know where you are logging in from. I see somebody already knows the drill. Someone saying happy Monday from Brooklyn. What's up? Brooklyn is in the house. I bid you greetings from the beautiful city of ATL, Atlanta, Georgia, where it's a little dreary, but we still have got the sunshine. So excited to be here with you all tonight and to talk about this extremely important topic that is important for all of our health, right? And so important and such a difficult topic or difficult issue for many of my patients living with multiple sclerosis. So I have got an amazing expert with me tonight, Dr. Chantel Branson. She is an assistant professor of neurology at Morehouse School of Medicine in Atlanta, Georgia. She is trained in sleep medicine. She is trained in movement disorders. Listen, this girl is trained, okay? And we are going to get into it tonight and talk about the importance of sleep. And not only that, Brain Chat is really so much about empowerment. And I want to make sure that before we end tonight's show that we've got some tips to help us to do better with our sleep and to understand the importance of getting enough sleep at night. And I see a couple people from ATL. I see Chicago is in the house. I was just in Chicago last week. That's my hometown, Chi-Town. And then I see somebody's calling in from Louisiana. All right. And I see Chicago again. Will we talk on sleep apnea? We will touch on sleep apnea just a little bit, but we're going to do another dedicated show to that as well. And of course, Brain Chat likes to thank our sponsors, Janssen, for sponsoring our podcast. And you can visit more2ms.com to learn more about our sponsor. All righty. So let me bring Dr. Branson up to the podium. Dr. Branson, happy Monday. Welcome to Brain Chat.
Thank you. Thank you, Dr. Williams, for having me. I'm excited to be here.
Awesome. So listen, sleep is so important. And I want us to get right into it because this is going to be a doozy. I'm sure we're going to have lots of questions in the chat. For those of you who have maybe been logging on to Brain Chat for the first time, if you have questions, you can put them in the chat and we will cover them kind of at the end during a Q&A portion of the program. But so tell us a little bit about yourself, Dr. Branson, and how you got interested in sleep medicine.
Yes, thank you. Thank you again for having me. So a few things just to talk to you about. I am a board certified neurologist. I completed my residency training at Boston University. I did 2 fellowships, as you said. I'm well trained in movement disorders and then sleep medicine. I wanted to do a sleep medicine fellowship to learn more about how sleep can affect movement. But during that time, I learned so much about sleep, even more than that, more than just movement, but how it can affect us as individuals and how it can affect our memory, our thinking, all of these different types of features and factors. And I want to hopefully we'll get to it. I just want to jog my memory as well. Just hit on some of the misconceptions about sleep and how we have been trained in society to think one way. And when I did my sleep fellowship, I learned I have a whole new appreciation for sleep in general.
Mm-hmm. Absolutely. Well, we are definitely going to get into all of it. So let's start, as you said, by talking about, let's talk about what does sleep do, right? So we kind of know when we are asleep, but what's going on when we go to sleep?
Yeah. So when we're sleeping, our brain does so much. We used to think that, our mind just kind of shuts off and regenerates. And there is a portion of it that does do that. But even with that, our body is working. It's helping to consolidate memory and thinking. So I know people who have a good night's sleep, sometimes they'll wake up and they feel well refreshed. On the other hand, if you don't wake up with good night's sleep, or you pulled an all-nighter, you might feel a little foggy and you might not be able to remember or comprehend. So our body is working on consolidating memory when we're sleeping. It also helps get rid of some of the hormones that are associated with Alzheimer's disease. And a lot of people
Oh,
don't know about that either. In addition to that, our sleep helps our body to kind of regenerate and helps it to make sure that we are able to uh, do just basic functions throughout the day. When you're a kid, it also depends on your age. So when you're younger and you're growing, there are hormones that are involved to help with growth and with different types of stages of growth when you're younger. So that's why you notice that kids or babies need more amount of sleep than older adults and things of that
so, speaking of babies and kids, so my kids are really grumpy if they don't get sleep, and my baby girl, she needs her beauty sleep. So we're talking 10 hours is her optimal. But obviously, many of us don't have 10 hours to sleep a night. So, how much sleep do we actually need? So, I've always heard 8 hours. Most recently, I heard about an article that said we needed 7 hours. So, how much sleep do we need each night to kind of go through all this regeneration?
Yes. So we have learned through studies that your sleep or the amount of sleep that you need is dependent on your age. So as you stated, your daughter or your child needs 10 hours. Some who have infants or babies are longer than that, right? You can also notice though that there is a pattern. As we get older, we don't need as much sleep as say an infant or a child. Once again, that sleep is helping with growth hormones and other things of that nature that you won't need as you get older. There is not a set amount of time that you need, like too much. Ideally, we focus on like how you feel in the morning, if you feel refreshed or not. We do state or have noticed studies have shown that less than 6 hours of sleep can be harmful. So we
Mm.
don't want to have less than 6 hours of sleep, but the amount of time you're getting uh, will depend on each individual. But if you notice you're sleeping for 8 hours or 9 hours and you still don't feel refreshed when you wake up in the morning or when you wake up, because people may have different sleep patterns or sleep cycles. You sometimes have shift workers and things of that nature. So it doesn't matter exactly when you're sleeping. Ideally, as long as you're sleeping for consistently about 7 to 8 hours if you're an adult, but you can sleep less than that. This the less than 6 hours is the time that we want to just make sure we don't have that issue with, because once again, that goes back into having problems with memory, having other problems as well.
Mm. Yeah, that
I
makes a lot of
also
sense. Go ahead.
Yeah,
Mhm.
I just want to also add, going back to those preconceived notions or ideas that we've had before. When we're younger, when we're growing up in the society we live in, they say, "Oh, you don't have to sleep. You need to, do this. You need to work. You need to spend all of your time doing this or that or whatever it is that you do, being a parent or whatever you're doing." And we've learned that sleep really helps. Even if people say, "Well, you need to be up all night studying." Those ideas of how we devalue sleep within our community can be detrimental as we get older.
Yeah, I think that's so key. When you said devaluing sleep, I remember when I was in college and med school, I used to say sleep is for suckers, right? And there are even T-shirts that say sleep is for suckers, you know. But really, we do need that sleep, you know. And in retrospect, there are lots of things that I don't remember, and maybe it was because I wasn't getting any sleep, you know. So let's talk about the effects of devaluing sleep and not getting adequate sleep. So I have so many people that come into my office and say, Dr. Mitzi, I have insomnia. What is insomnia? What does that mean? And what are the effects of insomnia?
Yeah, thank you. That's a great question. There are two types of insomnia, and it depends on the length of time you have the problem with sleeping. Insomnia is usually based on difficulty with either falling and or staying asleep. Most commonly, it's problems with falling asleep. And usually we look at a timeline. If it's acute, then it's less than 3 months. If it's chronic, then it's more than 3 months. But there are different factors we look at for insomnia. There are various different reasons. And some of the factors we have external, meaning outside, meaning if you live near a train and at 2 a.m., the train goes by and it's a loud noise, that might be more of an external factor and things that we talk about and flesh out when you're seeing a sleep specialist or a physician. Internal factors may be what we call primary sleep disorders. Primary sleep disorders include obstructive sleep apnea and other problems related to that. So there are certain questions and going through the sleep bedtime routine that people just don't realize. Like I said, going back to how we're conditioned to watch TV in the bed at night, right? Or we may be conditioned to uh, scrolling through our phone, looking at our emails, trying to catch up on work, and we have 5 different screens in the bed at nighttime and don't realize that that could be hindering or causing problems with you falling asleep.
Mhm. So let's take a pause because we had a question earlier about obstructive sleep apnea. Now, that is one of the things that I do talk to my patients about, especially those who say that they sleep for a long period at night. And they wake up and they don't feel rested. Sometimes my MS patients can feel that, but sometimes it's undiagnosed sleep apnea. So, what is that?
Yeah, great question. Sleep apnea usually occurs at night when people are getting less air into the lungs, and therefore causing less oxygen going to the brain. It can cause these events, we call them apneic events or hypopneic events, where there's decreased oxygen and therefore our body has to respond to it. It can cause these very frequent arousals. And the most common way that we look and evaluate for this is through a sleep study. The difference between some of the features I'm going to talk about for your typical sleep apnea and our women with obstructive sleep apnea, they can look very different. Typically, people have this loud snoring. They may have something where the partner will notice that they suddenly stop breathing for a short period of time when they're sleeping. Once again, the snoring, you may not notice it, but your partner may. So it might be related to that. In women, we've noticed that studies have shown that they may not have all of those very classic features. It might be something of being sleepy or tired during the day, and not as much of those what we call witnessed apneas. That's when the person who's their bed partner notice that they suddenly stop breathing for a short period. So it can be a little challenging to kind of flesh out. We try to use some tools and questionnaires to see how often are you feeling sleepy or tired and what you're doing during the day. If you notice that you're dozing off or nodding off during the day while you're watching TV or just after a meal or while sitting in the car or something of that nature. And then that's called, sometimes can be called excessive daytime sleepiness. And that
Yeah.
sometimes we can, you know, um, fish it out with the difference between fatigue. Most of the time, if you're fatigued, you really don't have that nodding or dozing off during activities compared to someone who has excessive daytime sleepiness.
Yeah, and I actually have a family member who had severe sleep apnea, and literally we would be sitting there talking, and they would just fall asleep in the middle of a sentence. Like I was like, "Oh my God, you have sleep apnea." And then I think, another key thing you said is kind of distinguishing between that and fatigue. Now, fatigue is a very, very common symptom that we see with multiple sclerosis. Many of the people that I treat, have difficulty with fatigue, and it can be so disabling that people actually have to leave the workforce. And so it's extremely important when we're talking about fatigue that we try to eliminate secondary causes. So for MS, they would be secondary causes like sleep apnea or other things that are very treatable that could be contributing to the fatigue that may affect people's everyday activities. So, what are some other things that could cause insomnia? What about depression or mood issues like anxiety? Could that cause people to awaken early or have difficulty falling asleep?
Absolutely. In addition to, we like to break it up, those external factors that we've talked about, internal factors would include depression or anxiety. If you're in your bed for a long period of time, longer than 10 hours, or any type of mood disorder can sometimes affect your ability to fall asleep and stay asleep. Anxiety, you will have some of these racing thoughts and you just can't go to sleep. You're constantly thinking about what happened during the day or what's going to happen the next day, and that is also associated with a mood disorder. So those are also very common, actually more common than some of our primary sleep disorders. Although we want to really evaluate that for especially our women. In addition to that, there can be medication side effects. There are a lot of medications that people are on that don't just realize how it can make them sleepy or tired during the day, and so therefore they're taking more naps during the day, and therefore that's taking away from their ability to fall asleep at night. So they may come in
Mm.
saying they can't fall asleep, but then you look on their medication list and they're on a medication that can make them feel sleepy or tired during the day.
Yeah, so that's definitely something that we deal with multiple sclerosis because we have many people who take things like muscle relaxants, also, medications for pain, especially nerve pain. Those types of medications can make people very drowsy. So we always kind of have to walk this fine line between managing symptoms, but making sure that the treatment of the symptoms is not worse than the actual problem or that it doesn't significantly compound other MS issues. Now, you said one of my favorite words, which is nap. So let's pause for a second and talk a little bit about naps. Are naps healthy? And if people are taking a nap, how long should they take a nap? So, for instance, some of my patients who have a lot of fatigue say, if I take a power nap like 20, 30 minutes, boom, I'm back up to where I need to be, But there's also this, sometimes people lay down and take a nap and they might be gone for 3 hours and then wake up at 10 o'clock at night. So, what is a healthy nap? Should we all be taking a siesta? Tell us what your thoughts are about it.
Well, as you said, it depends. It depends on your underlying disorder. We definitely support them in certain disorders such as narcolepsy or multiple sclerosis or things that already have some underlying changes in the brain. So, in a normal, healthy person, ideally, you don't want to take a nap longer than, like you said, 20 minutes. Because if you sleep for longer than that, it will take away from the time that you need to sleep at night. And we call this sleep debt. Uh, Also, our shift workers are big with this as well. Because everybody is doing everything during the day. People who work at night then want to kind of do the same, have the same routine as people who do not work at night. So taking a nap, ideally, uh, it's okay if you do it within a certain time frame, and that's the hardest part. That's why just in general we're like, if you don't already have something underlying disorder, then maybe it's not the best because you just can't, unless you set, even if you set an alarm, some I've heard people say they don't even wake up and the alarm goes off, so that can be a challenge.
Yes, that's the hard part. I do have an app that I use, Calm, and they have these sleep stories, and it's like the perfect 26-minute nap. And so you wake up and you hear the birds chirping, and most of the time I get up, but sometimes I will turn those birds off and go right back to sleep. So you're absolutely correct. Sometimes it's difficult to control that time. You also said another disorder where people can have difficulty sleeping called narcolepsy. Tell us what that is, because sometimes people will come in with severe fatigue that we later find is related to MS, but they may think that they have narcolepsy. So, what is that disorder?
Yeah, that also goes back to this very excessive daytime sleepiness, meaning they're nodding off in various different situations all the time, constantly, despite getting about 9 hours of sleep. So they get a little bit more than most people of overnight of sleep. But for the reason of the underlying narcolepsy, they also are really still tired during the day. So the first step is to look to make sure that people are sleeping ideally between 7 or 8 hours a day, depending on how your own individual choice, and then making sure there's no external factors such as an train outside your bedroom, or internal factors, depression, anxiety, another primary sleep disorder such as obstructive sleep apnea. The tests that we do for narcolepsy include ruling out obstructive sleep apnea because they sometimes can look so similar. But narcolepsy can be one of those disorders that we do strongly recommend people taking a nap. And if you notice that you're dozing off, especially when you're driving, that is very dangerous. That's one of the things we talk about and counsel. We don't want anyone to get in a car accident or to hurt themselves or their loved ones. So it's okay to take that nap before you start driving, or to pull over in a safe space to make sure that you can, rest prior to getting behind the wheel. Ideally, you don't want to get behind the wheel if you're that tired. But sometimes we have people who shift work and things of that nature and just need to get into their car. So we tell them to just take that 20-minute power nap, pull up that Calm app, and hopefully they'll wake up.
Hopefully the birds will wake you up. Yeah, I mean, so that is excellent advice, And then in terms of the correlation between MS and narcolepsy, I have not seen a high percentage of patients with multiple sclerosis that also have narcolepsy. Do you know of any associations between the two conditions?
Well, there is this thought related to inflammatory factors, and these factors are thought to be a possible connection. And sometimes what happens is that we're just not testing or evaluating enough people to see that.
Mm,
It might be more prevalent than what we're catching because we're not testing or evaluating for it. Some
yeah.
of the medications that MS specialists use and the sleep specialists use are the same, particularly when they're trying to get them to wake up or stay awake during the day from fatigue.
Mhm.
So we could also be treating the underlying problem without having an official diagnosis.
That
But
is
yeah.
true because we do use stimulant medication sometimes to
Mhm.
treat fatigue. One other thing that sometimes can lead to insomnia or issues with sleep, particularly for people living with MS, is that they can have symptoms that wake them up at night, right? I have some people that have, bladder issues where they have bladder urgency or bladder frequency, where they're getting up 5 or 6 times at night to go to the bathroom, and that's interrupting sleep. Or people have spasticity and have bad spasms or bad nerve pain at night. So we also have to make sure when people are going in to see their doctor that they're looking at certain symptoms that may be worse at night, which can interfere with sleep, which can lead to insomnia, which can lead to more daytime fatigue. So, all these things we try to assess to make sure that we're making the correct plan, and also to make sure that we're trying to delineate, okay, what's the MS versus what's all this other stuff? Because if we're saying all this is the MS and the MS is worse, we need to change your MS medicine versus, oh, we need to take a step back and treat your spasms at night so that you can get some sleep. So those are extremely great points. Now back to insomnia. So what are the effects of not getting sleep? One of the things that I think is extremely important is to recognize that many of the symptoms, particularly of MS, can overlap with, sleep deprivation, like cognitive issues or other issues. So what are some of the symptoms or problems that can occur from chronic sleep deprivation, right? I have some people that say, Dr. Mitzi, I only sleep 4 hours a night. And I'm like, how are you alive? So what are the effects of chronic
Yeah.
insomnia?
Yeah, I have patients that are like, "Yeah, I only sleep 4 hours and I'm fine." And then I say, "Tell me about your memory." They're like, "Oh, okay." That's why I emphasize that. But other symptoms that can be associated with chronic um, sleep deprivation include chronic headaches in the morning,
Mm,
particularly. People can have headaches. People can also have problems with consolidating their memory, most of the problems are going to be connected around memory problems. So therefore, that's more short-term memory loss. Meaning, if the long-term memory stuff is fine, it's more of the, if someone gave you instructions about something new that you have to do, then that can be a challenge. Chronic sleep deprivation in younger people can also affect their growth. I tell the kids all the time, it's associated with, getting those growth hormones out, making sure people are growing appropriately. And the other thing, like I said before, it is associated with Alzheimer's disease. So there is a link of a hormone called alpha synuclein, and that can decrease and cause problems with Alzheimer's. So it's important to really think about how long you're sleeping and how it can affect your overall daily life.
Mm-hmm. Absolutely. So let's switch gears and talk a little bit about what can we do about sleep deprivation. So we talked about, okay, this is what it is. We know that it's detrimental. What can we do about sleep deprivation? How do we treat it? How do we treat insomnia?
Yes. Just to go back, I meant to say amyloid beta. Amyloid
Okay.
beta is
Hmm.
so how do we treat it? There are several different ways to treat it. It just depends on the cause. We talked about some of those external factors, and then we have internal factors. So just being mindful of how you're sleeping and what you're doing prior to going to bed. As stated before, ideally, if you can, you don't want to have a TV or iPad or or phone, because those screens have something called blue light, and blue light can interrupt or disrupt your ability to fall asleep or stay asleep. You want to turn that off about 30 minutes to an hour before bedtime. And you want to do something relaxing, something that you know will put you to sleep. Most people say reading a boring book, nothing intriguing, nothing you enjoy, but a boring book will put them to sleep immediately. And if you notice that you still have maybe racing thoughts or just can't fall asleep, even with doing that activity after 15 minutes, you can get out of the bed and repeat the activity, like the Calm app. If you notice, that helps you go to sleep better. Some people like to listen to music without words. I ideally recommend that you not turn on the TV, but some of my patients have a challenging time with that. So sometimes those timers are really good for people who just, have tried everything. And then what you want to do is kind of be mindful. Like I tell everyone, we have a morning routine, right? We don't get out of bed and walk out the house, right? We have a routine. You want to get into a habit of having a bedtime routine. You want to do things to kind of help you go to sleep a little bit sooner. So you don't want to eat 3 hours before bedtime. You don't want to drink caffeine, nicotine. All these are stimulants that can affect your ability to fall asleep or stay asleep. You don't want to eat heavy foods. Ideally, you want to also, you know, do something that you know is going to help you with falling asleep. So if you know that somebody stresses you out and they just get on your nerves, you may not want to talk to them right before bedtime.
Right.
You want to just wake up ideally at the same time every morning as well.
Yeah, so I do a lot of counseling for my patients about what you're describing, sleep hygiene, right? So developing that bedtime routine, and that may look a little bit different for everyone. I'm a big fan of sleep stories. I have my children listen to them. And actually, there is one with one of my daughter's favorite characters, Peppa Pig, and her dad literally reads a book about cement and concrete. Like, it is the most boring thing you've ever heard. But he has like 4 chapters that he reads about pouring concrete and making steel and things like that. And it knocks her out every time. And then I have stories that I listen to, and so I think we have to find those things. Other things that I also recommend often are things like doing yoga before you go to bed. There are like nighttime yoga programs you can do where you stretch. Um, and you also can do things like there's sleepy time tea some people will drink, which can kind of calm them down. Also, things like meditation or prayer, which is a form of meditation, can help kind of relax your mind before you go to bed. So I think that, all those things, you just have to kind of try it out and see what's the best thing for you. But certainly decreasing that blue light. I have a friend of mine who says ban blue light in the bedroom, so getting that blue light intake down really makes a difference, and then developing that routine. What about melatonin? I have a lot of people that say they try melatonin, either it works or it doesn't work. Should people be taking melatonin, or what is it supposed to do?
Right. So melatonin is actually a natural hormone that is already in the brain. It helps balance out your sleep wake cycle. So light activates melatonin. Ideally, when you wake up and there's light, you start to build or store melatonin in the brain. And then when you go to sleep or at nighttime, when there's less light, it depletes, it goes away, it dim. Uh, we recently have been recommending melatonin for certain people. However, the American Academy of Sleep Medicine just came out with a recommendation and discussion about that.
Mhm.
That's still uh, pretty new, but they are saying that because we don't have enough studies that are large scale studies. So we have what we call anecdotals, meaning, based on my patient population, based on this person's patient population, but not a wide-based, a broad study to show that it really helps or not. And
Mhm.
so they have noticed that there's been an increase in melatonin, but they don't. We're just not sure, if there are any side effects that we're just not catching. The anecdotally, and once again, you should talk to your doctor about this. Anecdotally, I prescribe melatonin. I recommend it
Mhm.
to our patients, especially if they're having problems with falling asleep. It's better
Mhm.
for those people who are having problems with falling asleep. If you're having problems with staying asleep, then you want to make sure there's no underlying primary sleep disorder. We talked about sleep apnea and other things of that nature, or external factors, like you said, if you're having to go to the bathroom frequently at night, or you're having muscle cramps or stiffness that's causing it. Pain also is a number one factor associated with problems with sleep as well. That's a big one.
Mhm. Yeah.
So just making sure those are not uh, one of the culprits or causes of it. But then the next, I recommend melatonin.
Mhm.
Anecdotally, some other sleep studies or sleep specialists have noticed that sometimes a little bit of a higher blood pressure has been associated with it. But once again, there's no studies to really show this. And it also depends on the dose. A lot of people who come in, they say, oh, well, I tried it and it didn't work. They may have tried some of the gummies. And that's the other thing that they were trying to get with this most recent study is there's so many different types of medications, especially with melatonin attached to it, unfortunately. You want to try to get melatonin by itself. The melatonin gummies and things of that nature, it's made in a batch, right? So the medication's made in a batch, it's mixed together, and then they break it off and make whatever gummy that they want. So the amount of melatonin is unknown in each individual gummy. Does that make sense?
Mm. Yeah.
So I have a lot of people who say, "Oh, it didn't work for me. I tried the gummies." I say, well, maybe we can stick to the pills and don't take, try the melatonin without any, you don't want it associated with anything else. Sometimes they mix them with other things, and you can just see that easily on the bottle as well.
Mhm. Yeah, I mean, listen, and the gummies aren't good for your teeth anyway. But yeah, so what about other medications, right? So I have a lot of folks that come in and say, Dr. Mitzi, if I could just sleep at night, life would be better. Can you give me some Ambien, or I need some sleep medicine? What is the role of medicines like Ambien and sleep medicines? And should people be taking those chronically, or is that like a short-term solution?
Yeah, absolutely. Ambien is supposed to be short term. The best therapy we have for people with insomnia is cognitive behavioral therapy. And
Mm,
that's really understanding the underlying cause of the insomnia and treating it with behavioral changes. Once again, you have a wake up routine, whatever it might be, you have one. We don't get out of the bed, we don't walk out the house. We have to learn how to have a bedtime routine. And that goes back to what I was talking about in the beginning about society and how we have devalued sleep and said, oh, or we want things so easily fixed easily. These problems maybe have been going on for years, but we can't fix it with one medication. Particularly some of the medications you mentioned, such as Ambien. These medications are for short-term use, ideally 3 months. And you're like, oh, my doctor's been having me on it for years. That this is what the FDA has approved it for. And I'm sure people have seen news stories and things of that nature of how if you mix Ambien with alcohol or you take it on a plane, I mean, it can cause other problems as well, particularly with dreams. And some people, it can actually cause the reverse effect. People want to fall asleep and they notice they can't sleep with it. So these medications particularly can have some side effects that you don't anticipate or cannot predict. Ideally, my goal tonight is to really talk about and encourage us to rethink how we want to manage and treat our problems with sleeping, particularly when it comes to insomnia. We have to kind of change our mindset on it. We have to manage our expectations. This is not going to be, treated overnight because there's so many different factors, which we just talked about. Some of the external factors, if you have kids, if your babies are in the bed with you, if they're waking you up, if you're nervous about sleeping because when you were a young child, something happened and now you don't want that to happen to your own child. Like all of these underlying secondary problems really take time, and we have to really flesh that out and have a conversation about that so that we can really learn what is the underlying problem with why I cannot fall asleep.
Yeah, so I love that, right? It didn't take us a day to get here, and it's not going to get resolved in a day. But we really have to look at, some of those underlying issues and really reframe the way that we think about sleep, just the same way we think about now self-care, therapy. These are things that people talk about all the time that previously were not talked about in general conversation, especially in some communities. And so now when we think about self-care, let's add sleep to that list. Sleep is a form of self-care. Getting adequate, refreshing sleep is important. And developing that nighttime routine. I love that. The way that you're framing that is extremely important, just like we have that morning routine. We get up, we brush our teeth, we make our bed, we get dressed, hopefully, before we walk out of the house, right? We eat breakfast or drink our coffee, drink our tea, whatever it is, whether that routine is before we leave the house or partially when we get to work or what have you. We all have those things that we do on a regular basis that help us to be successful. What about the role of exercise in helping us to sleep at night?
Yeah, great question. And just to go back to that reframing mindset, we often hear these Fortune 500 people who, made millions or billions, and they're like, oh, I didn't sleep at all, or I don't sleep at all, and that's how I make all of my money. But then you learn their backstory and that their father donated this amount of money to them and gave this to them. So once again, it's just going back. I just want to reiterate again the collective whole part of it. Maybe they started off a billionaires and millionaires before, and their wealth just grew, And so some of these companies or people who are owning these companies are now talking about the importance of sleep. And exercise is just as important as that. It is important to try to get the exercise in the morning. You don't want to have exercise at night or too close to bedtime because there can be, depending on how intense your exercise is, something called endorphins that are released. And these are hormones that can naturally just give you natural energy. And those are very important. Sometimes, as you know, with some of the patients, they're so fatigued, they're so tired that it's challenging for them to get up and just do the exercise, or depression can make people difficult for them to get up and do the activity. So typically I recommend an accountability partner, someone you're friends with or who you feel comfortable sharing this with and doing that. sometimes I'll just prescribe physical therapy just so that they can get up and go to the, center, even though I know this is some of the things that they can do at home, because that's how important it is.
Absolutely. Absolutely. So, as we are coming to a close here, I see a couple of questions in the chat. Let me scroll through and see here. So, someone had a question about vaccinations and sleep. So, I don't know of any issue related to vaccinations and sleep unless someone had some type of reaction. Do you know of any data concerning that?
No, but I can talk to you about COVID-19 and sleep with the virus. Many people have noticed that if they have or are infected with the virus, then they may have problems with sleeping at night. It can be related in secondarily to the cough that they may or may not have. Some people notice that their sleep is a little bit different or has changed, particularly their sleep cycle. So I haven't seen anything with the vaccine and sleep, but COVID-19 and sleep problems have come up.
Now, what about a person who has, let's say, a sleep routine? I have a question here. Someone has a sleep routine, and let's say they're used to getting 5 hours of sleep a night, every night. They just get those 5 hours, and that's what they're used to. How would you approach maybe if you wanted to get more sleep? Is there a way that you can retrain your body to sleep for a longer period of time?
Yeah, yeah, definitely. So this can occur, especially with our teenagers and or older people. So sometimes we, as we get older, can have what we call advanced sleep cycle. It's only a disorder if it's disruptive or a problem for you, particularly the young kids who can't get out of bed in the morning because they need to go to school and they're missing schooling issues of that nature. That's delayed. That's a delayed sleep. They're going to bed later and therefore they're waking up. They need to wake up later, but they just can't because of, work or school. And then in the elderly or older population, they're going to bed early and then they wake up at 3 o'clock in the morning and wake up everybody in the house and everybody's mad at them. So typically what we do is try to determine what their best sleep wake cycle is, and that's just what naturally maybe writing in a little sleep diary to keep track of how you fall asleep and when you feel refreshed. Ideally on the weekends, people don't have obligations and things of that nature. Once they find out the best time for them, we can give them a little bit, tiny 1 milligram of melatonin, depending on the time that they need to fall asleep or stay awake um, at night. So I'm going to just give you an example. We have a teenager, right, who's going to bed at like 1 o'clock in the morning and therefore is not waking up till 7 or needs to catch the bus at 6. So we try to change or train their sleeping time to have them go to bed a little bit earlier, like 12:30 or 12 or something like that. And then when they wake up at 6 or earlier, if they need to catch a bus, they have to have something called light, natural light. Ideally, it's great if you can, and if you're not in Georgia or it's the winter months, you may need to get artificial light, and it just depends on how much you need, how much brightness you may need for that. So the best way to kind of prolong or get better sleep is to wake up, have the same wake up time every single day, even on Saturdays and Sundays, and then also exposing them to that light, exposing yourself to that light. Your body automatically would go to bed even without the melatonin. Disregard that. That's just for a specific disorder. Um, with with that natural light or light that you need to purchase, then um, it'll help extend your sleep.
And then what about other medications? So other medications, for instance, some what we call old school antidepressants sometimes are prescribed for sleep. Are those long-term or short-term solutions ideally?
Well, the antidepressant medications that are prescribed for sleep can sometimes be long term. They have two possible mechanisms or reasons for prescribing them. And sometimes you may not have depression. I don't want you to look at your medication cabinet and be like, oh, did you think? No, but it is very helpful for what we call short term, meaning the falling asleep and staying asleep. So it's very helpful. The medications for some of them can have a half life about 12 to 15 hours. So, it can help with your sleep, and it will be the most common, what we call long term treatment. Some of the other medications we talked about, Ambien, some of the Z drugs are more short term treatment.
Mhm. Perfect. Well, we have had an amazing conversation. And as we're kind of wrapping up, tell us, what thoughts you want to leave with us about the importance of sleep, and how people can be empowered to improve their sleep routines.
Yeah, thank you again for having me. This was a great conversation. I really, really want us to retrain our brain and the way we think about and the way society has taught us about sleep and the lack of importance of it, and that it's just trivial, and that if you don't sleep, I grew up my my paternal grandfather would say, I'll sleep when I'm dead, right? That mindset of just work, 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 work. Don't allow your body to rest. You cannot be at your best if you don't get the right amount of sleep. And that will be individual. It depends on, each individual. But you really want to try to at least make that same routine that you do or you have in the morning at bedtime. You really want to think about sleep. Like, what am I doing? What am I not doing? Like, often, once again, we walk into the house. Some people just walk into the house at after work and they just lay in the bed, like, or they just, turn on the TV and just want to drown out the thoughts or the noise during the day. We really want to start thinking about, what are those thoughts? Why am I having them? What is that noise that I'm trying to drown out with the TV? Why am I having it? And just, have that conversation, not with yourself, but also a professional, to really understand that, so that you don't have these problems in the long term. So you won't have problems with your memory or your thinking, so that it can help just overall help you feel more refreshed, so that you can exercise in the morning and get up and do the activities that you want to do.
Yeah. Amazing, amazing advice. So folks, sleep is important. We need to reframe the way we think about sleep. Dr. Branson has given us some amazing tips. So I want everyone to start working on that nighttime routine, whatever that is. Do some stretching, some yoga, some essential oils, sleep stories about concrete with Peppa Pig, whatever it is that you need to do that works for you, to improve that sleep, because we definitely need it and we can't go without it. So, thank you all so much, Brain Chat family. Thank you so much, Dr. Branson, for sharing so much wisdom and so many nuggets for our patients to empower themselves. And we will see you all in 2 weeks on Brain Chat. Have a great evening, everybody.